rising rapidly. And if you ask me why I believe that, it's not on this slide. I do believe that the combination of a virus making parasites and fungus and bacteria grow is part of it. It gets your colon and your GI and your blood, everything's off kilter. I think a combination of a lot of vaccines and a lot of things happening with people also can add to that. You know, I say this all the time. I don't believe vaccines are what's caused everything. I think it's a tipping point. I think our environment's toxic. We're around a lot of toxins. And then when you put extra things in our bodies just can't handle it, right? And the colon is one of those things that is contained, but it really, really does carry bacteria, fungus, and parasites. Unfortunately, in the United States, we don't talk about this enough. But I was on the phone this morning with Krista and with a friend of hers, and she works with a lot of doctors like Beckman and Kaufman and a bunch of guys all over the United States. And we were talking about, you know, how much fungus and parasites affects things in our world and in our bodies. And I've talked to you guys about this, and probably not enough, but when I made these products at Root, I really was focused not on just viruses and bacteria and heavy metals, but I was also focused on parasites and fungus, because I understand that 5G can activate, for example, parasites, and they breed in the fungus. I understand that spirochetes from Lyme disease, in my opinion, it's a type of a parasite, right? And it breeds in the fungus. I understand that when you have Alzheimer's or Parkinson's or dementia, we know now that there's fungus and parasites in the brain. I know now that with organ cancer, like colon cancer, pancreatic cancer, bowel cancer, bladder cancer, pancreatic cancer, I could go on and on. I know that there's a link to the parasites and the fungus, as well as bacteria, heavy metals, and viruses that cause the epigenetic to occur. I also have read a lot of studies and studied throughout the world where people that have heart attacks, you know, they actually have different parasites and fungus that are attached to an epigenetic. And I want to explain that. When you have an animal and they have heartworms, none of us question that. Take them to the vet and you check, and they have heartworms, right? They'll tell you when they have them, or they have pinworms. With human beings, that doesn't really occur in the United States. In other countries, it does. If you have a heart issue, no one's looking to see if there's also parasites or fungus. Same thing if you have colon cancer. But I'm here to tell you guys that when I worked on the Root products, this was a major focus of mine. Not just trying to get rid of the heavy metals, but trying to affect the body so that we support the immune system, so we can get rid of the epigenetics that are causing everything that stem from the root of viruses, bacteria, heavy metal, 5G, pollution, fungus, parasites, all of these things. So when we're talking colon cancer, for me, I'm not just thinking what's being taught in medical school in the United States. I'm thinking what is being taught all over the world, and how can we really help people that have this. I am being exposed to a lot of people right now. I want you guys to know this, with colon cancer. On a daily basis at this point, I am impacted on a Saturday or Sunday, 5 to 10 cases of something that has to do with the colon, also with the heart, pancreatic cancer, breast cancer. There's a rise in cancer. So all of this perfect storm that's fit together, we need to be a solution that helps people's bodies support their bodies to get rid of the things that shouldn't be in their body. Colon cancer, if you guys know anyone that was diagnosed with it or is diagnosed, the colon is the large intestine or the large bowel. Most of you guys know that. The rectum is the passageway that connects the colon to the anus, which is really why a lot of times people will have colon cancer, but it has spread to the rectum or to the anus, or they'll find rectal cancer and then it's also in the colon. It's because they're all connected. And cancer cells talk. We know this, right? So they talk and they grow. And this is something that you really have to pay attention to. It matters what you eat when you have this. It matters what you do. It matters the level of stress. It matters what you're on from a supplement perspective, I believe. I think it's important that people are really trying to protect their bodies from this before it occurs, right? And once it does occur, I think it's time to double down and really help your body get rid of it. Sometimes the colon has abnormal growths like polyps. I've had polyps, just so you guys know. I have always had trouble with my stomach. I have a couple of children that have problems with their stomach as well. My mother does, my sister does. We all have stomach issues. Relive Greens helps me tremendously in that area, and I'm thankful for it, as well as the Trinity. That's been something that's really helped me with all the issues that I have in my stomach and in my large intestines and large bowel. That's really helped me overall. But when you go back and you look at colon cancer, I want you guys to know that a lot of times it starts with just benign clumps of cells like polyps that are they're not cancerous. But over time, it can become colon cancer, which is why it's really important to do colon screening on a yearly basis or bi-yearly basis after the age of 40. It's really important that you test for this, or that you at least let the doctor know if you notice any changes in your bowel movements or anything that's happening. Many treatments are available for colon cancer. It includes surgery, radiation, immunotherapy, and of course, chemotherapy, as well as natural products that can help support the body during things like this. So we're going to go to basically the colon cancer protocol. We got these from different case studies all over the world and came up with a protocol that we thought could help people. I'm going to go back to what I said during the last review. These protocols, they can change because everybody's DNA is different. Everybody's diagnosis or treatment is different when it comes to colon cancer. Some people do a radical surgery. Some people just do radiation. Some people do chemotherapy. Some people do all of it. Some people do natural treatment. So there's a lot of different things people use. Our protocol is meant to be used with or without these things. If you are doing chemotherapy or radiation, we always advise that you talk to your doctor. A lot of doctors don't understand natural supplements, and they'll say you don't need to be on this while you're doing a treatment. And I always say this, wait a 24 to 48 hour period if you're getting radiation or immunotherapies, so that you can make sure that that time frame is not the exact time frame that you're on these products. That being said, there's a lot of patients that doctors have had throughout the world that do it during that actual day. But my advice is usually to take that break during that day or the next day. So either 24 to 48 hours. Here's our protocol that we came up with because of other the doctor's recommendations on the case studies. 2 times 8 drops in the morning and evening for 3 days. Then for 3 days, increase to one drop every 3 days to 2 to 10. And I'll tell you guys, this is what the protocols are showing. But for me, people that with colon cancer, if they can get up to the 10 drops twice a day faster than this, it's better. But some of them can't, especially because it has to do with the colon. You have to be really careful. So you've got to really weigh what's going on with each individual. And a clean slate, in my opinion, is extremely important to help really clean the body out, get rid of the things that shouldn't be there, and support the patient while they're going through different things that have to do with this. 0 in, 1 in the morning for 3 days, then 2, 1 in the morning and 1 in the afternoon, then 3, which is 2 in the morning and 1 in the afternoon. You can split that up to 1 in the morning, 1 at lunch, and 1 at night if you don't have issues with sleep when it comes to clean slate. It comes to 0 in, sorry. Some people sleep better on 0 in, like Clay, and I think Patrick does sometimes, and a lot of the doctors do. I personally take 0 in the morning, and I typically don't take it at night. But if I had colon cancer, I'd probably take it 3 times a day, breakfast, lunch, and dinner, or 2 at lunch and 1 in the morning. And the reason that's important is 0 in is not just for neurotransmission. 0 in, like we talked about before, has turmeric, curcumin. It has L-theanine, pine bark, and velvet bean, all that are known to really stop the signaling of the cells talking that are bad and support the immune system. So 0 in is not just for performance of the brain, it's performance of the body and the healthy cells in the body. Restore, the protocol that we came up with was 1 sachet in the morning for 3 days, then 1 sachet in the morning and 1 sachet in the evening for 3 days. then 2 sachets in the morning and 1 sachet in the evening. So you're going up to 3 sachets. You again can do that if you want to change it to breakfast, lunch, and dinner. If you do not have the money to buy 3 packets of Restore, take 1 packet of Restore and break it up. If it were up to me, again, you would do it 3 times a day. And the reason I like the 3 times a day with the Restore is because you want to hit a steady state and a peak plasma and have it last through the day. So if you take 1 at night, you know that's helping your body through the night. And that's why, even though it's not on this protocol, that's something that I would recommend to people. The natural barrier support, again, to help the body, 1 teaspoon in the morning. The Relive Greens, 2 teaspoons in the morning and in the evening. So you're up to 4 teaspoons. You guys know I take 3 to 4 a day. I was in LA with Ted and Clay, and I ended up taking, I think, 8 teaspoons. and I was in a meeting, and I had to get up like 4 to 5 times to go to the bathroom. I felt great, but I kept having to go to the bathroom. So people that ask me, how do I help myself with constipation? Relive Greens. Just so you guys know, Relive Greens is very good at cleaning out your large bowel, cleaning out the intestines, really helping the body get rid of the things that shouldn't be in there and cleaning things out. People ask me about a parasite cleanse, or they ask me about doing different types of detox cleanse. And I just really want to emphasize this. Do not leave out Relive Greens unless you're allergic to something in that formula. If you're doing the Trinity during a detox, or you're doing the Trinity during a cleanse, make sure you're adding the Relive Greens. It's very important. The Immune Defense Shield, 2 in the morning and 1 in the evening for 7 days. Then 2 in the morning and 2 in the evening. And I know the bottle says something different, but when you're trying to really fight things like this, you need to support the telomeres, the mitochondria, give energy to your body, and make sure you're really supporting the good cells. We know that NAD IVs are used for cancer all the time. This is a supplement that we're using to really support people's bodies while they're dealing with this. Again, we're not making claims. We're simply stating these are things that can really help. We know that black cumin seed, for example, that's in Restore, helps shut off the signaling of cancer cells. We know that turmeric does, and resveratrol, and raspberry ketones, and all of those things. So you've really got a great protocol here to help support the body during this and help the body get rid of the things that shouldn't be in the body during a time that your body needs to be perfect, really, to fight something that's not good. So I think that I'm missing one of the slides, but probably we didn't put it in here because we are not presenting to doctors today. For your doctors, by the way, that are in your groups, the doctor-to-doctor call, when we do this, we will present additional information so that the doctors in your group can also educate people that are in your downline so that they understand even more about these protocols. This particular study is a randomized control study. You guys know I love randomized control studies because we're able to really look at outcomes across different varieties and different statistical analytics. This one looks at high green leafy vegetables reducing DNA damage in adults that have a risk of colon cancer. This looked at the vegetables, and it also looked at the risk of red meat. Many of you guys know that there's an increased risk with colon cancer with red meat. People that have colon cancer, it's not recommended that they eat red meat 3 times a day, for example. You're recommending usually with these individuals that they have grains and fish and things that are really clean, and not fish that are oily, but fish that are very light and clean. So if you look at this particular study, it was a 12-week randomized controlled crossover trial. And it looked at different RMs and GLV. So basically, you're looking at what's the intake, what's the outtake, and what's going on throughout the body during that 12 weeks. The objective was to report on not just primary, but secondary outcomes. Participants were recruited and enrolled in 2018. They stratified them by gender, and that means they took genders and put them into both arms of the trial because it was randomized into 2 arms. And they looked at basically immediate intervention groups and what happened when they had these greens or when they had the red meat versus the ones that didn't do it immediately, to see what would happen and how quickly it would happen. Would there be any results that could possibly help with colon cancer? The summary of it, because you see the K1 and the P values and everything, but if you look at the summary of the entire trial, it did look at basically an increase, and it looked at lowering basically the increase of risk that could occur, because they looked at fecal microbiota, and they looked at the abundance of what was happening. And so basically the summary was that if people were on the green leaf vegetables, they did much better. And the longer they were on the green leaf vegetables, the better they did. And the quicker that it started, the more you saw an improvement. So for example, people that started the greens in the beginning did much better than people that started the greens later, because they were really looking at fecal blood and fecal imprints. And when you look at the imprints in the fecal tissue and what comes out in the microbiome and microbiota, you can see whether you're predisposed to cancer. It really is like a precursor. So this does show that it helps to take things like green leafy vegetables, which you guys know are in the Relive Greens. The next slide talks about curcumin and in colon cancer. These studies, by the way, guys, are pretty intense. And the reason for that is colon cancer is such a major topic, and there are a lot of trials with animals as well as with humans. What we don't talk about enough is the fact that those trials also include natural supplements, and we don't show those enough, which is why we're showing those to you guys today. If you look at this study, it was a review, and basically it investigated the protective information around in sativa seeds, which is your black cumin seed. It also looked at properties of curcumin, but if you really look at the overall study, they were looking at the black cumin seed and how it suppressed the inflammation in the rats around the colon and what was happening. It even suppressed it in the brain and in the overall body. I've seen a lot of studies that are looking at your basically TGF-B1 and looking at the expression of what can cause cancer, and how black cumin seed and curcumin are really two of the major things that will lower that inflammation and that expression. And that's because they're really shutting off the signaling of the cancer cells again, and they're causing support of the other agents and the other things in the body. So again, you've got a positive review of overall studies. The information that's on this slide doesn't go into as much of the curcumin, but in the actual study, you see a lot of things that has to do with curcumin, and we have, gosh, probably 100 studies which support this basic information, showing that either curcumin or black cumin seed, which is in sativa, are actually very, very helpful, not just in an IV formulation, but also in oral administration. They can help with different types of colon cancer and the support of the body, really in that growing. Because let me explain this. In colon cancer, the inflammation starts and the growth factor starts, and it grows pretty rapidly. If you can shut that off and really induce a cancer cell death of what's going on and stop the tumor from growing, then you have success. So one of the things is really looking at protective and promising agents in curcumin and in sativa, which is black cumin seed, are two of the things that really are able to support the body in this hopefully not occurring, or when it does occur, stopping that signaling. And I do want to say another thing. I actually was part of a team, and I owe a phone call after this for you to a family where we were helping with colon cancer with the doctors, and they weren't able to eat, so we were able to put the Restore on their body and on their skin. And I think I've talked about that before, even around where the incision was, where they had surgery, and where the radiation and the chemotherapy occurred. The doctors were fine with that, because they were like, well, how much can that hurt or help just to put Restore on it? What they did first was they rubbed the clean slate and then the Restore 30 minutes later. And now this particular patient is getting ready to be able to take it orally as well. I just have to get on the phone with them so that because she's doing significantly better. But I, of course, understood that it's bioavailable and it goes to the body, and then it can actually hopefully help in that area. And whether it's been the chemotherapy or the radiation or our products, I'm not sure, but this person has become a miracle because she was supposed to die within 2 weeks and she's currently living. And I think it's a testament to her family and believing, listening to her, believing the doctors, but also looking for outside reasons why their daughter could live and supporting her in that. And so I say this all the time. It's not just the products, it's mental, emotional, spiritual support, psychological support of people. Your brain is so powerful that when you are having something like colon cancer, you need to, at the same time, imagine that colon cancer dying, right? You're cutting off the oxygen. I did Erica West had a birthday present for me. She introduced me to someone that did like this healing session, and it was 35 minutes. And I did it last night. I actually fell asleep. And the entire time I fell asleep, I envisioned all these positive things happening at root, positive things happening with my children, positive things happening with my health and in my life. And if you ask me, does that make a difference? Absolutely. There's a lot of studies that show that as well, which I don't have in this slide deck, but I want to tell the root community, it does matter what you're thinking. It does matter what you're doing. Yes, natural products can help you during critical times and health issues in your life, but your mental and emotional health can as well. So just remember that when you're doing these different treatments, imagine the inflammation going away in your body. Imagine the oxidative stress and how your body is being supported so that your life is getting better and you're just basically mentally getting rid of these tumors and this cancer in your body. This is what you have to do. It's a positive process constantly to really focus on the enemy that's inside your body and getting rid of it. We understand this a lot when it comes to, I'm going to go back to animals. When an animal gets sick, what do? We hold the animal. We love the animal. We feed the animal things that can help the animal. We're people. We've got to give that same treatment of love to ourselves. When we know something is wrong, it scares us. When we know we have cancer in our body, we're scared and we don't know what to do. So what you can do and what you can give your friends and family members is this positive hope and then supportive things that can go into their body and communicate with the cells, supporting the good cells and getting rid of the bad cells. So let's talk about another type of cancer. Lung cancer is horrible. I have to tell you, any of you guys that have experienced a family member that has had it, it's horrific, because to be suffocated and not be able to breathe because you're dying of cancer is horrific. And a lot of times it's either primary or secondary. It can come from another organ. So for example, when you have colon cancer, it can spread to the lungs, or when you have lung cancer, it can spread to the colon or the pancreas, but it's really a hard cancer to treat. We have more treatments now than we used to, but my roommate in college, who's one of my very best friends. We lived together for 7 years, and her mother had lung cancer, and it was horrible. She died while we were in college, and it was really, really bad and horrific. So I want to tell you guys, any of you guys that have gone through it or had family members, I do understand how horrible it is to sit there and hold their hand and go through things. I've had a couple of other studies that I was involved in with lung cancer, and it's just a horrific thing to deal with. So how do we have hope? How do we do different things that can really assist the body in dealing with this, so people hopefully have a longer and better life, right? Because it's not just how long your life is, it's how you're living your life and what that experience is like. Lung cancer begins in the lungs, but as I said earlier, it can spread to the lymph nodes or other organs, or to the brain, which is another really hard fact about lung cancer. Again, I already talked about this. Cancer from other organs can spread to the lungs too. So you're either, when you have lung cancer, it's either primary or secondary. It can metastasize. And you guys, any of you guys that know cancer, that's not something you want to hear. It metastasizes to your lymph nodes. It metastasizes to your bones, right? That's bad. But I don't want people to give up. It's just one of those things that you have to fight extra hard. And the success rate is not that great, but my dad had head, neck, and throat cancer, stage 4, advanced, and had metastasized to all those lymph nodes, and he's alive, many, many, many years later. So I always want to point to the cases that are different, that are not typical, that are outliers, because I don't want people to give up just because they have a diagnosis of something that they're scared of. There's two main types of lung cancer: non-small cell lung cancer and small cell lung cancer. Each has a separate staging system that doctors use to classify how advanced it is. Staging helps the doctors predict the outlook, but still every person's different. Like you can give an outlook of you're going to live 2 weeks or 3 months, and you can live for 9 years, right? Or 12 years or 20 years. So you guys just need to know that when the doctor gives you that diagnosis, it's what they're predicting based on other people, but everybody's different. And there's always situations where people are miracles. There's always situations where other things help the patients as well, or the chemotherapy and radiation helps the patients. Let's talk about what kind of protocols we have because of some of the case studies. Again, this protocol is not here to claim that we're curing lung cancer. It's here in support of patients that have it and what they can do about it to support from a natural perspective. If you look at Clean Slate, you can see that it basically starts at 2 drops, 2 drops 6 times a day. Sorry, 6 drops 2 times a day. And then it goes up to at two times a day, 12 to 15 drops. And you guys know that I've told you before that sometimes I'll take 25 drops or 50 drops in a day when I really get sick. That's because I'm scared, because I have cancer. Once you have it, it's in your body somewhere, and I'm always trying to get rid of it, as well as the spiral sheets from Lyme disease and the heavy metals. I don't recommend this for everyone. I will tell you, if people are taking that amount, you need to drink lots of water, and you need to make sure that you're really paying attention to everything else going on in your life. If you can't keep water down, there's no reason to take this high of a dose. So people that cannot keep fluids down cannot take this high of a dose. You've got to be able to have water or green tea or things that will help it come out of the system and really get rid of the things that shouldn't be in your body. The Restore, if you look at this, again, it's a half a sachet in the morning for 3 days, then 1 in the morning for 3 days, then 1 in the morning and 1 in the evening, then 2 in the morning and 1 in the evening. If it were up to me, I'm just going to tell you, I'm going to go against this protocol a little bit, because I would be doing 1 in the morning, 1 at lunch, and 1 at night, if you have an option. That way you're keeping it through your system, and that way at night it's going as you sleep. You're helping assist your body with everything. So if it were up to me again, and I am not the one that does these protocols, we take it from a cumulative effect of case studies that we do. But if it were me and I was helping someone in my family, I would do 1 in the morning, 1 at lunch, and 1 at night. So you can see that every doctor is going to have a different protocol, and people are going to look at this differently. So you guys have the option. But what you want to do is you want to raise the level of ingredients in the body that really have turn off signaling to cancer and support the immune system. And Restore is one of our stronger formulas. Natural barrier support, 1 teaspoon in the morning. Relive Greens, 1 teaspoon in the evening for 3 days, then 1 teaspoon in the morning and 1 teaspoon in the evening. I would also tell you, you could go up to 4 teaspoons, so 2 in the morning and 2 at night, or again, you could go and also do it at lunch. And the reason you would do 3 times a day of any of this is to keep the same serum levels up throughout the day in the system and throughout the night. But again, you can alternate depending on the person. I would recommend that with some of this stuff, definitely that you're eating food if you're going up to the higher doses. You're taking a bite, just a bite of something, because when you go up to the higher doses of some of this, it can hurt your stomach a little bit while you're learning to basically deal with the higher doses. Also, immune defense shield, 2 in the morning and 2 in the evening. If you ask, can you do 0 in during this? You can do 0 in, but I would not do more than 1 or 2 a day of the 0 in if you add it to the protocol. So we're going to talk a little bit about the scientific studies. So Quercitin, which you guys know is in our immune defense shield, we know it suppresses lung cancer growth because it targets Aurora B kinase, right? So it's targeting that. And this is one of the reasons I love Quercitin. It's really, when you look at high expressions of cancer cells, and not just lung cancer, but a lot of cancer cells, if you look at the aura B kinase, it basically is highly expressed in a lot of cancers, and it causes tumorigenesis and progression. It makes the tumors grow and progress rapidly. So it's important to target for drugs to treat tumors. So when you make human monoclonal antibodies or drugs, scientists are always trying to target this to turn this off so that the cells, the cancer cells don't grow. Quercitin was identified as an anti-tumor agent in lots of studies. We also know that it inhibits aura B activity by directly binding it to in vitro and in vivo. So that's huge, which is why when you look at the protocol, it talked about basically 2 and 2. If you ask me, could you go higher? You could, but that's what our protocol is recommending. You just want to, again, mentally think about, I'm turning the signaling off. I'm supporting my body. I'm limiting the tumor from growing, and I'm supporting the healthy cells in my lungs to grow, because that's your goal. You do not want the cancer cells to take over the lungs. You don't want them to metastasize. You want to turn that signaling off and really support the body. If you look at the rest of the study, it talks about in vivo studies and how it inhibits, again, the aura B activities in different cells like JB6, C141 cells. All of those are directly related to this, and A549 lung cancer cells. So it's really important to turn, again, that off and support it. And we know that quercetin can do that. Also, if you look at this particular study, it talks about tumor-bearing mice and how it suppressed the cancer growth with them. Again, another very, very important fact. Also, if you look at histone 3 in tumor tissue, it was decreased. And histone 3 in tumor tissue is something that you don't want to see, and you hate seeing it grow. So it's really important to decrease it, and we know that quercetin treatments can do that. We also know certain treatments of NAD can do it. You've got NAD and quercetin in your immune defense shield. Another thing, the last bullet talks about is that both, again, in vivo and in vitro, which is huge, you guys. So that means in a lab and in people, right, or in animals. So in a lab in a petri dish, when you're treating this cancer, or in an animal or a person, it's suppressing the growth of the lung cancer. So again, that's a really important fact to understand and to know. And again, mentally, to tell your body, listen, I'm giving you this body. I love you. Like, you're amazing. And I am helping you shut off the tumor growth, right, of this particular target. That's what you really want to be saying to yourself. And then you're going to be envisioning it through meditation and prayer so that you're really doing all of it. And I say constantly, don't think for 1 second that your brain and your emotional and mental health is not connected to your physical health. It's all energetically connected. We're going to talk about black cumin seed again, one of my favorites that we keep talking about. We know that Nigella sativa has been used as a traditional medicine for centuries. If you look at the Bible, if you look at the Quran, if you look at pick a religion, the Buddhists have books that they read, the Hindu Bible, all of it, they talk about black cumin seed or black seed, right? And it's because traditionally throughout centuries, this oil and the thymoquinone is extracted from the seeds because it's in the seed. It's a characteristic of the seed. And we know that it helps things like cancer and cardiovascular, diabetes, asthma, kidney disease, all kinds of things, cognitive functioning diseases, which is why I've always used black cumin seed in a lot of things that I make. I mean, it's one of the targets that I always focus on. We also know that it's effective against cancer in the bloodstream, lungs, kidney, liver, prostate, breast, cervix, skin. I could go on and on. So you've got that in Restore. And that's something that is a huge focus. And if you look at this, and I don't think I have this slide on here, along with spirulina and the aloe vera, as well as chlorophyll and all the things that are in Relive Greens, again, you're trying to get the body to cut off that signaling. If you look at this, the molecular mechanism behind black cumin seed and its anti-cancer role, we still don't completely understand it, but we think it's blocking the pathways and targeting the pathways that the cancer cells are trying to take. And we think it's targeting, again, stopping that cell that has cancer from growing and even causing necrosis. So a slow cancer death, or apoptosis, which is a death of the cell. And so that's a good thing, right? If you kill a cancer cell or if you cause a cancer cell to slowly die. We also think that TQ has an antioxidant role. There's lots of studies that show that. And then it improves the body's defense system, which is what I love about it, because you're trying to cause cancer cell death, but then support the good cells of the body. That's what you're trying to do. You're trying to get rid of the gang members that are trying to take over your body, which is a city. And then you're wanting to get rid of those bad cells, support the good cells, and have them grow, have them step up, be warriors, and say, that's it. We're not gonna allow you to kill our body or to grow cancer cells anymore. That's your goal. And you want to think about it mentally and emotionally and psychologically as well. So we're going to go on to a new cancer. I don't think we've ever done as much as we're doing lately as it pertains to certain disease states. So I hope this is helping you guys in your communities. This talks about non-Hodgkin's lymphoma. And if you look at non-Hodgkin's lymphoma, there's a lot of people that have been impacted by this: children, adults, Hodgkin's and non-Hodgkin's, right? Lymphoma. And I've done quite a bit of studies and been involved in a lot of studies in this particular area as well. So normally your lymphocytes, which belong to the white blood cells, go through a predictable life cycle. So they have a cyclic effect. It's like we go through a life cycle. What people don't understand is that also lymphocytes do that, and some of our other blood cells do it. They go through this cycle, right, of aging and of growing and of splitting and of doing all these different things. Old lymphocytes die and your body creates a new one to replace them. In non-Hodgkin's lymphoma, the lymphocytes don't die and your body keeps creating new ones. So you have too much. And that's why when your doctors look at your white cell count, your lymphocytes, and your red cell count, they're looking to see that everything's normal and then it's handling itself appropriately, because you've got to have this balance. If you have an oversupply of lymphocytes, they crowd your lymph nodes. And that's when you get like swollen lymph nodes. Doctors will like fill your lymph nodes under your arms, on your everywhere, because you have lymph nodes everywhere. And if they feel like they're growing or that they're hard or swollen, they worry about non-Hodgkin's lymphoma, because that means maybe now listen, some of you guys have swollen lymph nodes and you just have a cold or a virus. But if this keeps going and it never goes away, then doctors are concerned about it, because your lymph nodes are swollen for not just because of a virus or bacteria or parasites or fungus. They're swollen because of something like cancer. So that's why they're always checking. Another thing about non-Hodgkin's lymphoma, it's a type of cancer that begins in your lymphatic system. So your lymphatic system is affected, which means your overall body is affected when this happens. Your bloodstream, your organs, everything is affected, because your body is not able to fight germs as much. It's harder to fight bacteria. It's harder to fight anything in the body when this happens. Your lymph nodes aren't working appropriately. They're not taking the trash out, right? So you really have this problem and this burden that is affecting the entire body and not just one isolated area. So there's different types. We go to the next slide of non-Hodgkin's lymphoma. They can start in the lymph tissue. I think I've already said almost all of this. Different types affect adults, but it also can affect children. Sometimes it's better to be an adult and get this because of how the body fights it, and sometimes it's not. I know that sounds weird, but it depends on how the non-Hodgkin's lymphoma progresses and what treatments are used. But a lot of times, again, you're worried about the lymph tissue, and your lymph nodes, your spleen, your bone marrow, your thymus, your adenoids, your tonsils, your digestive system are all affected by this. And again, I just talked about this. It's because it's all connected. And so when your lymph nodes are not working and your immune system isn't fighting itself right, your spleen is affected, the bone marrow of the body is affected, the thymus, which is a small organ on the upper side of the breastbone near the heart, it's affected. Your tonsils, everything are infected, and you have a hard time breathing. A lot of people with non-Hodgkin's lymphoma, they find it because they can't swallow or they can't breathe right, or their stomach hurts, and then they find out that they have this non-Hodgkin's lymphoma. I want you to look at the slide too that has the pictures. You see the normal cells, and then you see the abnormal cells. And when a cell starts to be abnormal, what you want to do is you want to give the body ingredients that will get rid of that abnormal cell. You're targeting the abnormal cell. You're trying to get it to die either slowly or quickly, so that then you only have normal cells. Because if you look at the slide at the bottom, there's an abnormal cell in the middle, but there's normal cells around it. The problem is with non-Hodgkin's lymphoma and other types of cancer, the abnormal cell wants every other cell to be abnormal too. It's like, I'm in a gang, I'm in a club, join my club, right? And so they try to get all the cells to look bad and to be bad. So our job is to use certain things inside our body that go in and target our body so that you give growth and strength to the normal cells and get rid of the bad cells. So what is our protocol for non-Hodgkin's lymphoma? Again, it goes back to clean slate, restore, relive greens, natural barrier support, and immune defense shield. And I'm going to go over this one more time. You're going to try to go up to at least 10 drops twice a day. On this protocol, it says 2 drops, 5 drops 2 times a day. And then you gradually go up to 3 days at 2 times 12. So you're more than 20 drops a day. At that point, you're going up to 24 drops, but some people even go higher. Some people take the clean slate morning, lunch, and dinner. If it were my family, if it were my children, people ask me this all the time. If it were I hate even saying that, if it were me, that's what I would be doing. I would be doing all of this 3 times a day just to keep the steady state, because you're trying to fight something. If I'm not sick and nothing's going on, twice a day is fine. But if you want to do it morning, lunch, and dinner, you can split that up into your, 6 drops in the morning, 6 drops at lunch, 6 drops at night, right? Or you can even go higher, 7, 7, 7, then you're at 21 drops. Those are things you can do depending on what you think. But if you're taking medicine or doing chemotherapy, remember, you just want to make sure that you're taking a break. If you're taking like an oral medication, you're going to wait at least 45 minutes to an hour between those. If you're doing a chemotherapy and radiation, you're going to take a break that day. If that's my recommendation. And again, we're not telling people what to do. They have to do their own medical advice. We're not claiming to cure this, but I'm just giving you examples of different things that different doctors have done and recommendations on protocols. Restore, it talks about a half a sachet in the morning for 7 days, then 1 in the morning for 7 days, then 1 in the morning and 1 in the evening. You could go up to 3. Again, if you don't have the money for that, you would do 1 packet 3 times a day, in my opinion. You can get away with doing it just in the morning and at night. But again, my recommendation goes a little bit against this protocol because I would try to split it into 3 times a day if you can. If you're too busy, and there's too much going on, which is really my life and probably a lot of your lives, just make sure that you're getting the product in and taking it so that it is trying to support the body to get rid of these bad cells that shouldn't be there and to keep the good cells healthy and to get the immune system to work. You want to get the inflammatory cascade down and you want to cause calm so the good cells are thriving inside the body. Natural barrier support, again, 1 teaspoon in the morning. Relive greens, 1 teaspoon in the morning and 1 in the evening. I would recommend even 1 in the morning, 1 at lunch, and 1 in the evening, or 2 in the morning and 2 in the evening. I just think you need to make sure you're getting those Relive greens in there to really help your body thrive and to fight things. Immune defense shield, again, it's going to 2 in the morning and 2 at night. You may have to work up to that by starting with 1 in the morning for 7 days, and then 1 in the morning, and then 1 in the evening. The reason sometimes you have to work up to this is when your body is fighting something that's bad, you gradually sometimes have to introduce things. Some people have a theory that you just give it to them all at once, which I'm not against that theory. I know a lot of doctors, that's what they do with patients to try to get them really quickly into an area where their body's really fighting stuff. But some people's bodies aren't strong enough to handle a dramatic change, and it has to be gradual. So again, this goes back to who's the person that's taking this, what kind of therapies are they on, what does their doctor say, what do they think, what do they feel, what is their body telling them. So we're going to go into scientific studies. This talks about resveratrol. I think I've already talked to you guys about the curcumin and the black cumin seed and how it can help, but talking about really another thing that helps with cancer and that can support the body is resveratrol, especially with lymphoma and leukemia. And you're really looking at, again, triggering the cell death of the cancer cells, right? In this particular paper, the main mechanism of cell death triggered by or linked to resveratrol was discussed and reviewed for the whole article. And the main focus was looking at experimental models of resveratrol and how they were tested on a cellular, molecular, and physiological level. They wanted to see how is it really impacting overall. And when they looked at this, they confirmed basically the sensitivity of lymphoma and leukemia cells to resveratrol. And together, understanding that basically resveratrol can target the different components to get them to cause apoptosis or a slow death or a quick death, and really lower the ability for the cancer cell to thrive. So this particular study looked at that they could do additional studies that would show useful applications. And what that means is possibly using resveratrol in different types of pharmaceutical products or biotech products, because they know that it has the potential to stop the tumor cell growth, especially in these two types of different cancer, whether it's lymphoma or leukemia. But again, there's other studies that show its ability to help in multiple types of cancer. And then the next study again talks about black cumin seed, your black oil, Nigella sativa, on human lymphoma U937 cells. And we talked a little bit about this earlier. So in this study, it investigated cytotoxic and apoptosis really effects on in sativa extract. It looked at the mechanism of action and why is it killing these cells and how is it impacting them. And again, it goes back to the cytotoxic activity of thymoquinone, because it's really has this oil, and that's really the thymoquinone that's in it that's really targeting and getting that stuff to shut off. And it's amazing at the studies I've seen internationally and the things that have been done with black cumin seed and in sativa, which is why it's really important that you use at least one packet of the Restore, in my opinion, up to 3 packets. And some people I know have even used 5, because you're, again, trying to get the body to respond. I know I keep saying this, we can't claim to cure anything, but we can tell you, we can point you to the studies and to the information and what we're seeing and how it's been able to impact people and why. And I think that's what's really important, that you guys understand why. Why is it happening? And the real reason is because it's targeting these cancer cells and trying to get rid of them. In sativa, black cumin seed, multiple pharmaceutical companies have tried to own that, control that, and take that over because of its pharmacological effect, naturally or synthetically, if you use it with other delivery mechanisms. So it's really an important product to have in your arsenal, which is why it's in the Restore. I think that is about the end. Here's some more articles. We have tons more, so if you guys need them or want them, we can send those as well. But hopefully this will help people just have an understanding of why natural products can assist the body and can support the body. I love the fact that we have a company where we don't claim to cure anything, but we're able to help people all over the world, regardless if they have an autoimmune disorder or cardiovascular event, regardless of if they've been vaccinated or not, regardless of if they have cancer or not, regardless of their age. We're able to support people and give their bodies really things to support their life, making it hopefully a longer life and a better life. And we don't have to make claims about that. We have to show people the studies. We have to show people the data. We have to allow protocols to be shown. And then we have to give people the natural ability and the power to make those decisions on their own. We're not sheep. You know, we're in charge of our bodies. We're kings and princesses and queens and mayors and prime ministers and presidents of our body. So we don't need to follow what everyone else is telling us. We need to look into it. We need to listen to our body, and we need to help our body by giving our body the things that it needs.